Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, types of liver transplantation. So, we have different types of liver transplantation. First, orthotopic transplantation. Orthotopic transplantation is the donor liver is transplanted in the normal anatomical position after recipient hepatectomy. That is, you will do hepatectomy and you will put it in the same place, that is in the right upper quadrant of the abdomen only. Then it is orthotopic hepatectomy. Second, heterotopic hepatectomy. In heterotopic hepatectomy, you will remove the liver and you will place it at an alternative site rather than the normal anatomical position. So if you place the liver in an alternative site, then it is heterotopic liver transplantation. Then we have auxiliary liver transplantation. In auxiliary liver transplantation, the native liver which is present, the liver of the patient will be still present in the patient itself. Okay, the liver of the patient is normal and it remains inside the patient only, but the whole or partial transplant is added. Like you will not do liver resection in auxiliary liver transplantation. In auxiliary liver transplantation, you will not do liver resection. Only a new transplant, either whole or partial transplant, is added to the patient. Then we have piggy bank liver resection. In the piggy bank liver transplantation, here this is a type of orthotopic transplant which preserves the recipient inferior vena cava. Piggy bank liver transplantation is a type of orthotopic transplant. That is, it is similar to orthotopic transplant where you remove the donor lesion liver from the anatomical position and you sorry if you will remove the recipient liver from the anatomical position and you will replace it with donor lesion in the same normal anatomical position. But here in piggy bank liver transplantation, you will preserve the recipient's inferior vena cava. Then we have split liver transplantation. In split liver transplantation, the cadaveric donor liver is divided into two portions and each portion is transplanted to two portions and two portions are transplanted to each for one recipient. So total two recipients are benefited with one person's liver. Then we have reduced size liver transplantation. Now in the reduced size liver transplantation, here liver size is functionally reduced to the appropriate size for the recipient. So this is mainly done to overcome this reduced size liver transplantation is done to overcome the donor recipient size discrepancy. It is done to overcome the donor recipient size discrepancy and it does not increase the absolute number of grafts also. Then we have auxiliary partial orthotopic liver transplantation. In auxiliary partial orthotopic liver transplantation, here number 1, the left lobe of the recipient liver is excised and the donor liver occupies the vacated space. You will only do partial liver is removed and you are going to put the donor liver into the same space of the vacated space. That is the same in the right upper quadrant itself, wherever you have removed the left lobe over there. So if this is the liver and this is the right lobe and left lobe, if you have removed the left lobe, now you will take the donor liver and you will place it in the here itself. You have removed this part. Now this is left. Okay, now the donor liver is brought and placed in the similar place here only. So this is auxiliary partial orthotopic liver transplant. Then we have auxiliary heterotopic liver transplant. In auxiliary heterotopic liver transplant, whole liver or a lobe of the liver is placed in subhepatic space or it is placed in other non-adjacent area. So this is auxiliary heterotopic liver transplant.
thank you and thank you for watching.